Recently, actors Robert De Niro and Al Pacino have made headlines for having babies at a late age. You know, mothers are often the focus when it comes to how age plays a role in fertility and the baby's health, leaving fathers out of the important conversation. Today, though, I am joined by the Director of Male Reproductive Health at UPMC. We want to welcome Dr. Kathleen Hwang to share some important things that families should consider. Thank you so much for being here.
Thank you for the invitation.
You know, when we first heard about Al Pacino and then Robert De Niro, we started to really talk about this and the age of men when they have babies and how that could play a role. So is there a lack of education around male fertility, do you think?
I think so. I think women are much better at seeking care, and so men don't ask questions as often. But the reproductive system is such an interesting thing. So women are born with a set number of eggs, and you live with the same number of eggs through your lifespan. But guys, they don't have any sperm at birth, and then when they hit puberty, that sperm factory turns on. And it's amazing that this factory just goes on and it stays on for the rest of their lives.
For the rest of their lives. Now, does that mean just because you're making sperm that men should continue to have babies, is it still healthy to do that?
It's a great question. So, as with any kind of factory that stays on forever, mistakes start to happen the longer that it's on. So as you age, more things change about the health of the sperm. And certainly what we've learned is as you age as a father, from 35 to 45, all the way to 75 and 85, the sperm is not as healthy and there are risks.
I was gonna say, because at 35, I was pregnant with my third, and I was told I was a geriatric pregnancy. And that's at 35, so imagine being in your 70s and getting ready to welcome a new baby. So can we talk about some of the risk factors that come along later in life with some of these mistakes that you had mentioned?
Absolutely. So there are quite a few studies out there looking at that advanced paternal age, which is kind of this coined term at this point. When a dad is 35 years of age, the rates of miscarriage are higher already. When the dad hits the age of 45, there are pregnancy complications. So for the mom with pregnancy, higher rates of blood pressure issues, higher rates of placental issues, turning that pregnancy into a high-risk pregnancy. There are even obstetric complications where there's premature deliveries, higher rates of lower birth rates, and just a lot of things that change for the child itself.
So I know that oftentimes when there are fertility issues, if a woman family is trying to get pregnant and a woman is not able to carry at some point, do you find that men often seek help later after the woman has already gone? Is that typically when you start to see your patients?
Absolutely. So I would say 80% of the time the referral comes from the female partner. Mm-hmm. And so she has been evaluated by a provider and they've done the whole evaluation. Only till after they've completed it are they saying, hey, there's also a dad. The dad should have someone to talk to and make sure there aren't any risks that are reversible that we need to address.
So when people come to you, what do you examine? What do you look at?
So we ask them tons of questions, right? To learn about their environmental exposures, occupational, medical, surgical history. We ask about pregnancy histories, right? Like prior partners. So it's pretty extensive. They get a physical exam. And our goal is to try to identify any risk factors that might be reversible in any way that we could nudge that sperm health in the right direction by reversing certain exposures and helping them achieve pregnancies that are safer.
I don't know much about this, I have to tell you, but I know family members who have gone through fertility treatments and healthy eggs are extracted and examined. Is the same done for sperm, and could that be done for a man who is in his older, like in his 60s or 70s, who wants to have a baby?
Absolutely. So that's assisted reproductive techniques, right? So there certainly are opportunities where we can do sperm extraction. So sometimes the ejaculated sample where there's the sperm there might not be the healthiest. Mm-hmm. And so we can go to different sources, which is the sperm factory, which is in the testicle itself. So that's definitely an option.
I like how straightforward this conversation is. I have to say, we're not dilly-dallying or doing anything here. So what kind of conversations should dads be having with their doctor if they are trying to have a child later in life?
I wish everyone would ask that earlier, right? So what we want to avoid is to have the couple where one of the partners is 35, 40 and older and waiting years before they're asking for help. So the concept of preconception counseling, ask before you start and try. Because the earlier we can identify these risk factors, the less likely they're not going to be aware of the risks of this pregnancy and for their kids.
I think about female care, and you know, oftentimes, I know for me, I started going to a doctor, going to my gynecologist at 14 or so, and then you see them yearly until You don't. But for men, they don't have that same kind of care. Would you like to see that change?
Absolutely. So what's very common is you'll meet a male partner as part of a couple that hasn't been able to conceive, and you'll ask them, when's the last time you saw a doctor? And the most common answer is my pediatrician.
Right. Wow.
Yeah.
Oh my gosh.
So it's been years and almost a decade plus, and so having that outsource of someone to be able to ask questions earlier, absolutely.
I do think, I mean, there has to be a difference between your PCP and definitely your pediatrician. But having someone so that you can be more comfortable about these conversations.
Absolutely. It's such a sensitive topic, and everyone's sensitive to the topic of both reproductive and sexual health, but we try to provide an environment where people can feel comfortable about this, and we're there to help them. And a lot of that sort of sensitivity is we approach it like it's your elbow. It's a different part of your body. We're just going to ask you the same questions to help you get to a better place.
This was such a good conversation. Thank you so much for coming on today and talking about this.
Thank you so much for having me.
So